Good evening, everyone. I'm Lissy Bastian with your JCN News for this Tuesday, October 20th. Thanks for joining us. COVID-19 cases in the country at nearly 6,000, with the Ministry of Health confirming 150 cases of COVID-19 for Monday. 81 of those cases here in the capital, one each on Abaco and Andros, and 67 with locations pending. The total number of confirmed cases in country now stands at 5,923, 4,541 confirmed cases on New Providence, 671 on Grand Bahama, 162 on Abaco, 57 on Bimini, 35 on Eleuthera and Exuma, 32 on the Berry Islands, 19 on Inagua, 15 on Andros, 12 on Long Island, 9 on Cat Island, 7 on Acklands, 5 on Crooked Island, 3 on Mayaguana, and 320 with locations pending. Health officials, in restructuring the way it presents COVID-19 details, reveals that 59% of the newly confirmed cases are female, 40% male, and 1% is unknown. 119 cases hospitalized, 76 at PMH, 26 at Doctors Hospital, 9 at the South Beach Acute Care and Referral Center, and 8 at the Rand Memorial Hospital on Grand Bahama. 108 patients are listed as moderately ill, and 11 cases are in intensive care. Health officials also reporting an additional death, that of a 64-year-old female of New Providence who died yesterday. Her death pushes the death toll to 124. The Ministry of Health also reporting 186 additional recoveries, bringing the figures in that category to 3,525. 2,236 active cases and 31,801 tests have been completed to date. While he is not in the country, Deputy Chief Medical Officer Dr. LaDawn Brennan is still employed with the Bahamas government. Prime Minister Dr. Hubert Minnis dispelling rumors on social media regarding the status of the Deputy CMO employment with the Ministry of Health. Just before the weekly cabinet meeting, Dr. Minnis confirmed that Dr. Brennan has been working remotely.
It is true, LaDawn Brennan is still employed with the ministry. He's Deputy Chief Medical Officer. He has relocated, joined his family. His family lives in Maryland, and LaDawn is stationed at the Washington, D.C. office, the embassy. He works virtually every day by the ministry.
Back in August, Dr. Brennan denied social media claims that he had submitted notice of intention to resign. The nation's chief went into details on Dr. Brennan's responsibilities, adding that the Deputy CMO is a perfect example of working remotely.
He's working every day. He's responsible, working with the Ministry of Tourism, and his responsibility is really border control. He is taking the forefront and leading the charge in terms of border control, the protocols, what needs to be done, how it's done, etc., and doing all the data collection and assessment.
Dr. Minnis adds that the government would want to encourage families to be together and says that individuals can work from anywhere around the world with the current technology available.
Individuals can live in Japan and work in New Providence, and can live in the UK and work in New Providence. You don't necessarily have to live on that particular landmass to be employed. And I would urge all Bahamians to become technologically savvy and advanced, because our jobs in the future can be jeopardized because an individual can be living in Ireland or New Zealand and working in Scotia Bank or Royal Bank, etc. So you must take advantage of it. But once we are technologically advanced, we too can be living here in New Providence and working at Wall Street or
Dr. Brennan remains a part of the country's COVID-19 task force, as Dr. Minnis adds that if there is a meeting that Dr. Brennan cannot attend virtually, he will travel to the country to attend the meeting. Well, just last week, Thursday, 13 Cuban nationals were apprehended in the Southwest Bahamas and transported to the capital by the Royal Bahamas Defense Force, where they were handed over to immigration for further processing. When asked about concerns of an uptick in illegal migrants entering the country, Minister with responsibility for immigration Ellsworth Johnson, speaking with the media just before the weekly cabinet meeting, says that in this pandemic, the propensity to move is greater as some economies are not doing well, and says persons would want to migrate to find a better way of life.
Let's get them to pay to send the people back.
But we've been signing deportation orders and we've been sending persons out. So that's what we've been doing.
Now on Friday, October 16th, the Department of Immigration carried out a repatriation exercise. The immigration minister says that the department officials discovered that a lot of undocumented migrants had employers.
And I want to say to Bahamians, ensure that persons who you have living at your residence are properly resident in the Bahamas. And this is not just about economic migrants. You don't want to have a terrorist, a money launderer, or whatever have you.
Though he could not give an exact figure, Minister Johnson adds that the government has spent too much money on repatriations since the onset of the COVID-19 pandemic.
Our job is, when we come into contact with them, is to ensure that the fundamental dignity of the human person is always protected. That we follow all of the protocols when we take them into custody, and I want to commend the police force, the defense force, and the prison force to do the very same thing. And so we're in close contact with the medical professionals who have been doing, performing admirably in these circumstances to assist not just at the hospitals, but all of these institutions as we go about enforcing the laws of the Commonwealth of the Bahamas.
Now, the immigration minister also assures that immigration officials are practicing all of the health and safety protocols when it comes to dealing with illegal migrants entering the country in this COVID environment. Well, it's no doubt that the stress of the pandemic have led to countless sleepless nights. In fact, local epidemiologist and member of the Progressive Liberal Party's task force for COVID-19, Dr. Melissa Evans, says she's seen an increase of insomnia patients by almost 100% since the onset of the pandemic. This is based off of her own data and research. She says this much during a recent interview on Jcn's Jones and Company talk show.
Just never do. They think that, okay, well, I don't sleep, not a big deal. But we've had so many people come in with insomnia-like, parasomnia-like patterns and nightmares, sleep terrors, that kind of thing. And I do believe, and that's why I touched on mental health a little bit before in prior segment. And I do think that mental health is becoming a tremendous issue. You know, people are unemployed. We have an economic problem. We have drug abuse, alcohol abuse now that it's going to become, of course, because of the pandemic. And then just the general fear of getting sick is, you know, it's causing a lot of people to present now with variable types of sleep disorders.
In an interview with JCN News, Dr. Evans added that the country does not look at the issue of mental health enough. She says that it's becoming a big issue, especially since the pandemic. Asked what the task force would suggest to aid in this effort, she says this.
We have to, I guess, be able to introduce the public to where they can seek mental help, like, you know what I mean, whether there be hotlines or, you know, places like that. Like right now we only have hotlines and stuff for COVID-19, symptoms of COVID-19, that kind of thing, if you want to leave.
You're watching JCN News. When we return, Public Works Minister addresses the shantytown issue in Andros, and an 11-year-old gives back. Stay with us.
This segment of the news was brought to you by Alive.